Welcome to Capitol Catch-Up, your deep dive into the latest action from the halls of Congress. I am Victor.
And I am Lainey. Today we are breaking down several major legislative efforts, starting with a group of bills aimed at our national energy grid, particularly how it is being impacted by the rise of artificial intelligence and high-demand infrastructure.
That is right, Lainey. We have seen a massive surge in energy demand lately, driven largely by high-tech infrastructure like artificial intelligence data centers. In response, lawmakers have introduced House Resolution 6529, also known as the Protecting Families from AI Data Center Energy Cost Act.
This bill is crucial for everyday consumers. It requires the Federal Energy Regulatory Commission, or FERC, to hold a technical conference within 90 days of enactment. They will bring together utilities, state regulators, and ratepayer advocates to find ways to protect residential and small business customers from bearing the financial burden of these high-demand data centers. FERC would then have to report their recommendations to Congress.
And that is not the only bill addressing this issue. House Resolution 9340, the Ratepayer Protection Act, goes a step further by amending the Public Utility Regulatory Policies Act of 1978. It establishes a federal standard where large load customers, defined as non-residential consumers using 100 megawatts or more, must pay the full incremental costs of any upgrades needed to serve them. This means utilities would have to get financial assurances from these massive industrial users before building new infrastructure, ensuring regular families do not see their bills spike. State regulators would have 2 years to implement this.
To make sure we actually understand these future energy demands, House Resolution 9332, the Load Forecasting Enhancement Act, directs FERC to set up regional joint boards. These boards, made of state and federal representatives, will study the best ways to predict electric loads, especially with large-scale industrial demands. Their findings will eventually help standardize forecasting across the country.
Meanwhile, House Resolution 9335, the Advanced Transmission Technology to Reduce Rates Act, focuses on modernizing the grid itself. It directs the Secretary of Energy to establish a public clearinghouse to provide technical assistance and cost-benefit analyses on advanced transmission technologies. Interestingly, it exempts certain federal funding from National Environmental Policy Act requirements to speed up deployment, and it mandates best practices for mitigating wildfire risks. But it keeps everything voluntary, explicitly stating the Secretary cannot force utilities to adopt these technologies.
Lastly, on the energy front, House Resolution 9339, the Affordable Innovation for the Grid Act, asks the Secretary of Energy to look directly at how artificial intelligence and high-performance computing can actually help improve the grid's capacity and reliability, with a report due to Congress within a year.
Let us shift gears to healthcare, where transparency is the main focus. We have 2 major bills targeting hospital and medical pricing. First, House Resolution 9390, the Prices on the Wall Act of 2026.
This bill is very literal, Victor. Starting January 1st, 2028, it would require hospitals, ambulatory surgical centers, labs, and imaging providers to physically display discounted cash prices for shoppable medical services right on their premises so patients can see them when scheduling care.
And to back that up, House Resolution 9393, the Lower Costs, More Transparency Act of 2026, requires hospitals to publicly disclose standard charges, negotiated rates with insurers, and discounted cash prices in a digital, machine-readable, and consumer-friendly format by that same 2028 deadline.
This one has real teeth. The Secretary of Health and Human Services would enforce this through audits and could impose escalating civil monetary penalties, up to millions of dollars, for persistent non-compliance, though there are hardship exemptions for rural or underserved facilities.
Next, let us talk about the bipartisan efforts to combat the synthetic opioid crisis. We have several bills here, starting with House Resolution 7970, the Stop Nitazines Act.
Yes, this bill aims to permanently classify 2-benzylbenzimidazole opioids, commonly called nitazines, as Schedule I controlled substances. This moves them from temporary status to permanent federal regulation, giving law enforcement stronger tools to prosecute their production and distribution. The Attorney General would have 1 year to finalize these rules.
Then there is House Resolution 2004, known as Tyler's Law. This bipartisan bill directs the Secretary of Health and Human Services to study routine fentanyl testing for overdose patients in hospital emergency departments looking at the costs, benefits, and privacy implications, and then issue guidance on whether this should become standard clinical procedure.
There is also House Resolution 8005, the Stop Pills That Kill Act, which targets counterfeit pills containing fentanyl or methamphetamine. It mandates that the Drug Enforcement Administration develop an operational plan to improve seizures and investigations, with a focus on youth prevention, and requires annual reports to Congress from the Attorney General.
And to help communities directly, House Resolution 1561, the Alert Communities Act, would expand the use of rapid testing strips for fentanyl and xylazine. It directs Health and Human Services to research and market this technology, authorizes grants for first responder training, and funds a study on how access to these test strips affects overdose rates.
Moving on to infrastructure and resource security, House Resolution 9338, the Pipeline Safety Authorization Act of 2026, aims to modernize pipeline safety protocols and secure funding through 2031. It clarifies definitions, ensures safety standards weigh both safety and economic benefits, and creates a confidential, voluntary information sharing system governed by a multi-stakeholder board so the industry can collaborate on safety data without fearing regulatory penalties.
On the resource side, we have two bills targeting critical minerals. House Resolution 9617, the Coordinating and Harnessing America's Recovery of Minerals Act, or the CHARM Act, tasks the Environmental Protection Agency with creating a national critical mineral recovery strategy to extract essential minerals from waste like mining and metal processing.
And House Resolution 9616, the EMRTAI Authorization Act of 2026, sets up an EPA program to recover critical materials specifically from contaminated sites, offering financial assistance to government, nonprofit, and private groups. This program has a $10 million annual funding cap and will sunset after 10 years. We also have House Resolution 9795, which expands temporary borrowing authority and mandatory distributions for the United States Victims of State-Sponsored Terrorism Fund.
Let us look at what has been happening on the floor. In the House Daily Record from July 30, 2026, Representative Jennifer A. Kiggins was appointed Speaker pro tempore for a brief, largely administrative session. They processed various executive communications, including national emergency continuations for Brazil and Lebanon, and introduced new bills touching on firearms, healthcare, and artificial intelligence in political campaigns.
Over in the Senate on July 29, 2026, the focus was on the Supporting Early Childhood Educators Deductions Act and a major push for the Lindsey O Sanctioning Russia and Iran Act. This sanctions bill, framed as a tribute to the late Senator Graham, targets the energy revenues of Russia and Iran, specifically their shadow fleet and major oil and gas purchasers.
Senator Grassley also gave a stark warning during that session, noting that the Social Security Trust Fund is projected to be depleted by 2032, calling for urgent bipartisan action to prevent benefit cuts.
Finally, we have several key executive nominations to note. Erica Schwartz has been nominated to be the director of the Centers for Disease Control and Prevention. Sean Kaufman is nominated to be Assistant Secretary for Preparedness and Response at Health and Human Services. Sarah B. Rogers is nominated to be the Chief Executive Officer of the United States Agency for Global Media, and Jennifer Johnson Carroll is nominated to be the Ambassador to Trinidad and Tobago.
That wraps up our coverage for today. As we look ahead, keep an eye on how these energy grid proposals develop, especially as the debate over artificial intelligence and utility costs heats up.
And watch for progress on those healthcare transparency deadlines as we get closer to 2028. Thank you for tuning in to Capital Catch-Up.
We will see you next time.